Hello everyone, now let us discuss about 2023 CPT coding guidelines for online digital E&M services. So what are online digital E&M services? They are patient initiated services with physician or other qualified healthcare professionals. Online E&M services, the CPT range is 994212 to 99423. Online digital E&M services require physician or other qualified healthcare professional evaluation, assessment and management of the patient. And these services are not for the non-evaluative electronic communication of test results, scheduling of appointments or other communication that does not include E&M. These are not for the non-evaluative electronic communications such as test results, scheduling the appointments or other communication that does not include E&M. While the patient's problem may be new to the physician or other qualified healthcare professional, the patient is always an established patient. Online digital E&M services are only performed for established patients. Patient initiate these services through Health Insurance Portability and Accountability Act (HIPPA) compliant secure platforms such as electronic health record portals, secure email or other digital applications such as Zoom call or Skype call, which allow digital communication with the physician or other qualified healthcare professional. Online digital E&M services are reported once for the physician or other qualified healthcare professionals. Cumulative time devoted to the service during a 7-day period. There is a 7-day period. For example, patient is going for online digital E&M services on 5th of August. So from 5th of August to 12th, that is within the 7-day period, if the patient again request for an online digital evaluation, in that case the time devoted to the service on the 5th of August and any of the day within 7 days, that day the time will be added and only one CPT will be billed. So online digital E&M services are reported once for the physician or other qualified healthcare professionals. Cumulative time devoted to the service during a 7-day period. The 7-day period begins with the physician or other qualified healthcare professional initial personal review of the patient generated inquiry. And the physician or QHP, qualified healthcare professionals, cumulative service time includes review of the initial inquiry, review of the patient records or data pertinent to the assessment of the patient's problem, personal physician or other qualified healthcare professional interaction with the clinical staff focused on the patient problem, development of management plans, including the physician or other QHP generation of prescriptions or ordering tests, and subsequent communication with the patient through online, telephone, email or other digitally supported communication, which does not otherwise represent a separately reportable E&M service. All professional decision making, assessment and subsequent management by the physician or other qualified healthcare professional in the same group practice contribute to the cumulative service time of the patient online E&M service. So all the elements, decision making, assessment and subsequent management, they contribute to the cumulative service time. The online digital E&M services, they require a permanent documentation of the encounter, that is electronic or hard copy. And within the 7 days of the initiation of an online digital E&M service, if a separately reported E&M visit occurs, then the physician or other QHP work devoted to the online digital E&M service is incorporated into that second separately reported E&M visit. Example, additive of the visit time for the time-based E&M visit or additive of decision-making complexity for a key component-based E&M visit. If time is considered for the selection of code, addition of the time, cumulative time is done for those 2 visits within 7 days. If medical decision making is considered, then the addition of decision making complexity is the key component. Addition of decision making complexity for a key component based E&M visit, and this includes E&M visits and procedures. It can be either a online digital E&M service, or if a separate E&M service is provided, and these E&M service, they include the E&M visits and procedures that are provided through synchronous telemedicine visits using interactive audio and video telecommunication equipment, which are reported with modifier 95 for the appended E&M service. If the patient is opting for a synchronous telemedicine visit, along with the E&M service code, you need to append 95 modifier to indicate the interactive audio and video telecommunication. You should not report 95 with the online digital E&M service codes, but you should report modifier 95 if we are going, for example, for an office visit or a outpatient office visit. Then you can append 95 modifier to the 99213 or 214 or 215 in order to indicate telecommunication, audio and video telecommunication. And if the patient irritates an online digital inquiry for a same or related problem within 7 days of the previous E&M service, then the online digital visit is not reported. If the patient frequently asks for a digital inquiry for the same problem or related problem within the 7 days, then you should not bill the online digital visit. If online digital inquiry is related to a surgical procedures and occurs during the post-operative period of a previously completed procedure, then also E&M service, online digital E&M service is not reported separately. And if the patient generates the initial online digital inquiry for a new problem, if the problem is new within the 7 days of a previous E&M visit that addressed a different problem, then the online digital E&M services may be reported. If the problem is new, you can report the online digital E&M services. And if the patient presents a new unrelated problem during the 7-day period of an online digital E&M service, then the physician or other qualified healthcare professional time spent on the evaluation, assessment and management of the additional problem is added to the cumulative service time of the online digital E&M service for that 7-day period. You will understand if we see the example. So as of now, if the patient presents for a new or unrelated problem within the 7 days, then you can add the cumulative time spent on the evaluation, assessment and management of the additional problem to the cumulative service time of the online E&M service that was performed within the 7-day period. These are the various CPTs for online digital E&M service. They are 99421, 99422 and 99423. 99421 requires 5 to 10 minutes of time of medical discussion, whereas 422 requires 11 to 20 minutes. And 99423 can be reported if the time consumed is 21 minutes or more. If it is more than 21 minutes, you need to report 99423 for online digital E&M services. These are the CPT descriptions. 99421, online digital evaluation and management service for an established patient for up to 7 days. Cumulative time during 7 days, 5 to 10 minutes. For 11 to 20 minutes, you need to report 422, 99422. And for 21 minutes or more, you need to report 99423. Now let us see examples. A 54-year-old established patient with hypertension and diabetes presents for physician appointment via a Zoom call. And the physician attends the patient and reviews the H1A1C report, which is 7, indicating stable DM. And the physician advises the patient to maintain compliance with the medication. The cumulative time or the visit time is from 10:15 a.m. to 10:30 a.m. So 15 minutes of time. The appropriate CPT for this online digital evaluation service is 99422. Online digital E&M service for an established patient for up to 7 days, cumulative time during the 7 days. The time is 11 to 20 minutes. When the time is between 11 to 20 minutes, you need to report 99422. Here the time is 15 minutes. So we are reporting 99422. Next example, a 10-year-old established patient recently did his annual physical exam on 1st June and all immunizations were up to date. Patient's request for online digital service on 3rd June due to fever and cold. Here the patient had a E&M service, preventive visit on 1st June. So within 7 days period, one E&M service has been done. But now the patient is requesting for the online digital evaluation and management with a new problem. So you can report the online digital evaluation and management service. So patient requests for online digital service on 3rd June due to fever and cold. Physician attends the patient and diagnoses upper respiratory tract infection and prescribes a course of antibiotics. Here the visit time for 3rd June is 11:15, from 11:15 a.m. to 11:25 a.m. So 10 minutes of time is consumed. Appropriate CPT is 99421. Online digital E&M service for an established patient for up to 7 days. Cumulative time during the 7 days 5 to 10 minutes. Since it is 10 minutes, you are coding 99421. And though a previous E&M service has been occurred within the past 7 days, but since the patient is presenting with a new problem, we are coding online digital evaluation service management separately. Let us see one more example. A 23-year-old established patient requests for online digital service on 3rd June due to fever and cold. The prescription attends the patient and diagnoses upper respiratory tract infection and prescribes a course of antibiotics. So for 3rd June, the visit time is 11:15 a.m. to 11:25 a.m. So 10 minutes. Again, patient again requests for visit on 7th June. So first visit on 3rd, the second visit is on 7th, which is less than 7 days. 7th June, indicating that fever is not subsiding. So no progress is there in the condition. And the physician changes the antibiotics and indicates to return to clinic. Return to clinic. RTC means return to clinic if fever is still not controlled. So the visit time for 7th June is from 10 a.m. to 10:15 a.m. Here the physician took 15 minutes of time. Previously it is 10 minutes. So you need to take a cumulative. That means you need to add the cumulative time. 10 plus 15, 25 minutes. So the appropriate CPT for the second visit, since it is within 1 week, for these two visits, only this CPT will be billed. 99423. Online digital evaluation and management service for an established patient for up to 7 days. Cumulative time during the 7 days 21 minutes or more. Since it is 25 minutes, we are reporting 99423. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.